A patient came with the inability to move his fourth and fifth digits. It is ulnar nerve. Where is ulnar nerve passing through? Typically, you are having the medial aspect of the humerus. So that is the reason it is the D through which the ulnar nerve is passing. Obviously, when ulnar nerve injury is there, you have the weakness, and if you pass a paper, then ulnar nerve basically supplies what? Interossei. Palmar interossei, you have dorsal interossei. Palmar interossei, adduct your fingers, pad. Dorsal interossei, abduct, dab your fingers. So when your palmar interossei are weaker, if you pass a paper between your two fingers, the adduction, that is one finger sticking with the other finger, is not strong. So if you drag the paper, it will come out easily. So that is the way you test for the interossei function, and indirectly the function of the ulnar nerve is what you have to basically remember. So ulnar nerve supplies interossei, palmar adduct, dorsal interossei, abduct is what you need to remember. And always a very important question is, you have lumbricals, you have interossei. What is the function of lumbricals and what is the function of interossei is very, very important question. Can you give me the board? What is the function of lumbricals, which are supplied by the ulnar nerve or any nerve, but what is the function of lumbricals? Lumbricals you can remember like this. You make your hand like this, right? Lumbricals. It is a L-shaped one, right? So this is the metacarpal bone, and this is the phalanx. Metacarpophalangeal joint, it will lead to flexion. And this is what, when you keep it like this is interphalangeal joint, right? So extension of interphalangeal joint, flexion of the metacarpophalangeal joint is the function of lumbrical. Lumbrical is what you have to basically remember. So one of the favorite questions of the examiner, function of lumbricals, function of interossei, which lumbricals, first and second by what, third and fourth by what, everything you must be 100% sure, especially brachial plexus, orthopedics may or anatomy may, out of 10 questions that, 15-20 questions that come, invariably there will be a question on either ulnar nerve or medial nerve or radial nerve or axillary nerve. One of the nerves, without that there is no paper, is what you need to remember. So flexion of metacarpophalangeal joint and extension of interphalangeal joint is typically the action of the lumbricals, is what you need to remember. A 5-year-old child, absence of thymus, hypoparathyroidism, and that is leading to tetany. So which branchial arch is associated with the development of both thymus and parathyroid is a very, very, very important question. So it is the area C between 4th and 6th is the location where you have the thymus and parathyroid basically developed. So what is meant by DiGeorge syndrome? In the DiGeorge syndrome, it is the chromosome number 22. You have a deletion, and because of that there is a hypocalcemia, there is a T cell defect leading to lot of infections, and there is also abnormal facial features like the cleft lip, cleft palate, etc. And there is a development of cardiac abnormalities like PDA. The combination which constitutes the DiGeorge is what you need to basically remember. So this is called the ultimobranchial body, the superior parathyroid and inferior parathyroid. So inferior parathyroid comes from third pharyngeal pouch and superior parathyroid comes from the fourth pharyngeal pouch. So the development of all these parathyroids, thymus, everything is all closely linked with each other. In case of the diGeorge is what you need to basically remember. So what does third pouch gives rise to? Inferior parathyroid and thymus gland. They are the two structures that are coming from the third pouch. Though it is inferior parathyroid, 3 is a small number. It comes from the third pharyngeal. Whereas superior is a higher number. Superior means higher. And fourth is a bigger number. So superior parathyroid comes from the fourth pharyngeal is what you need to remember. And typically if you look at the thymus gland, it is large at birth and up to second year, and it will typically show a rapid growth to 11th year, and then to the adult weight it will be growing around 12 to 15 grams. That is the story of thymus gland, and thymus gland is caudally moved down is what you need to remember. An area has been marked in this. Defect in this area, what does it lead to? This is the typical area where you find substantia nigra, and that lead to Parkinsonism, which is also called paralysis sagittans, is what you need to remember. Once more, basal ganglia is a very high yield topic in anatomy, both theory and DNB question bank, AIIMS question bank questions. You should be in a position to revise before you go to the exam. Definitely one question is going to come. Now doctor, you have the three RAT, rigidity, echinacea, tremor, that constitute the Parkinsonism, where substantia nigra there is a decrease of the dopamine. If you want to know where is substantia nigra, this is the brainstem. You have the pons, this bulging curvaceous structure is pons. Above that you have midbrain. At the level of the midbrain you have all these basal ganglia including the substantia nigra, if you happen to take a cut section of the midbrain. So this is what you need to know. Now comes the question. Examiner shows you one of the muscles of the mandible. You have pterygoids, lateral pterygoid, medial pterygoid. Then you have temporalis, masseter, buccinator. What is their nerve supply? What is their action? On the jaw. Every AIIMS May question bank of the examiner is very standard, doctor. Retrospectively you should know what is there in the question bank, what examiner is enthusiastic to ask you. Before you get into a fight, it is all 90% of time should go into strategy how to fight. All fight is only 10%. Right? So, हम एनाटॉमी पढ़ रहे या बायोकेमिस्ट्री पढ़ रहे हैं तो पूरा बुक पढ़े तो क्या मजा है? एमडी बायोकेमिस्ट्री में क्या करते? वही चीज करना है ना? So that is the reason. Don't aim to read all books and become 19 subjects Vedanti. You cannot become. You should know what I am going to read. What are those 100 pages I am going to read? That you should have clarity. Invest all your time into that. Once that investment is clear, that is the 650 topics I am talking about. Reading is no time, doctor. 650 topics into 15 minutes. एक घंटे में 4 topics खत्म. 150 hours is all that you need to waste your testosterone and estrogen rich youth instead of wasting time. Be very sure. So that is the reason last AIIMS November 2017 में भी lateral pterygoids के ऊपर question आया. Which muscle in this picture will open the mouth? That was the question in AIIMS November 2017. फिर AIIMS May 2017 में they are asking typically protraction is caused by this particular muscle, right? So let us quickly look into medial pterygoid. So let us look into the various pterygoids. Lateral pterygoid originates from sphenoid. inserts into the anterior surface of the mandibular condyle and it depresses, that means you open the mouth and it protracts the mandible and moves it side by side. So that is the function of lateral pterygoid. Medial pterygoid, it elevates the mandible. We shut the mouth because of the medial pterygoid. It also leads to protraction and side to side movement. Same things like the lateral pterygoid. Only thing is medial pterygoid closes the mouth. Lateral pterygoid opens the mouth is what you need to basically remember. So this is how the fifth cranial nerve, the nerve in the pons, it is the one, the mandibular division is the one which is going and supplying the lateral pterygoid muscles. Is the nerve supply. It is the nerve to medial pterygoid and is the supply to the medial pterygoid, and the branch of the anterior division of the mandibular nerve is a nerve supply of the lateral pterygoid is what you have to ultimately remember.